compromise gastrointestinal protective mechanism. It means that if you are drinking beer or wine, don't drink it on empty stomach, because this will increase the symptomatic and the gastric secretion, of course. And if you have gastritis, this will increase the pain. Gastritis and peptic ulcer may result when infectious, chemical, or neural abnormalities disrupt mucosal integrity of the stomach. The most common cause of gastritis and peptic ulcers is now known to be Helicobacter pylori infectious. And Helicobacter pylori infectious is very common in people with gastritis, people with even with people with anemia. You can ask or send the patient to evaluate, to assess if he has Helicobacter pylori. It's very common, not only in developing, but also in developed countries. It's around 50%, between 50 and 70% of the population is infected, and some patients are without any symptomatic, but if they have some changes in the taste, in the food preferences, even in the taste of water, it's very specific. They will explain, recommend them to check for Helicobacter pylori. And of course, the first step should be of therapy, should be to treat, to eliminate Helicobacter pylori. There is appropriate schemes, and in 3-week time, this Helicobacter pylori can be eradicated. So it's but Helicobacter pylori can cause chronic inflammation of the gastric mucosa, peptic ulcer, atrophic gastritis, achlorhydria, and loss of intrinsic factors. Vitamin B12 should be anemia. Vitamin B12 deficiency anemia can be also the reason of this one, and gastric cancer, of course. This is the most common complication, long-term complication. It increased with duration of infection. Classification of gastritis. Sydney system of classification. There is atrophic gastritis, multifocal, Helicobacter pylori, environmental factors, specific diet, and corpus predominant autoimmune. This is the reason for this atrophic gastritis. Other form of gastritis, chronic use of aspirin or other non-steroid drugs, also steroids, alcohol, erosive substrates, tobacco, environmental metaplastic atrophic gastritis. You know that maybe you remember during the COVID epidemic, it was recommended because the risk of thrombosis of COVID-19, it was recommended to take aspirin. In order to thinner the blood and to avoid thrombosis, but this aspirin, regular aspirin taking can create the risk of gastritis. Autoimmune gastritis, this is autoimmune metaplastic atrophic gastritis, poor nutrition and general poor health. Can be caused by chronic gastritis. Medical nutrition therapy. In atrophic gastritis, vitamin B12 status should be evaluated because it can be a deficiency. Maybe you know that now there are oral tablets for with vitamin D, sublingual, and 1,000 microgram is the doses. Daily doses, if there is a severe vitamin B12 deficiency, it should be confirmed based on hematological picture, hematological results, and also the level of vitamin B12 in blood. And if this correlates low level of vitamin B12 together with anemia, this may be the reason is this atrophic gastritis. Reduced absorption of iron, calcium, and other nutrients occurs in chronic gastritis. And in this situation, of course, supplementation is required. And also dietary recommendation for gastritis, a main principle of healthy nutrition, the purpose of which is to provide the body with all necessary complex of micronutrients, vitamins, proteins, fats, and carbohydrates, while not normalizing the activity of the entire digestive system. So, dietary technology should be appropriate for this situation. For cooking dishes, a steamer is used, boiling in water, and less often baking. Because of this crust that is formed, during the baking, the food should be as much as possible chopped so that the digestive system does not experience additional mechanical stress. So mechanical should be like small pieces or mincemeat, low fat. Rubbing is subjected to all products that are used for cooking to reduce the fiber, actually, because the fiber they can have a negative effect. It excludes food that can cause difficulties with digestion. It's all fried, smoked, fatty, spicy, excessively salty, or soup, cold or hot. So this is a temperature, mechanical, and some technological. Eating very small portions, but often enough, about every 2 to 3 hours. It's important to divide eating portions in 5 or 6 daily intakes. So small portion, but more common. And not too hot and not too cold. Diet with atrophic gastritis with high acidity. The atrophic gastritis with high acidity is directly related to nutrition. It appears against the background of malnutrition usually. This means that first of all, the patient should make the adjustment to his menu in order to take enough energy, protein, micronutrients, and of course, micronutrients are in addition added as a supplement. Actually, any gastritis involves the exclusion from eating spicy, fried, and fatty foods, smoking and drinking alcohol, and also canned food should be avoided. It's recommended fresh meats and fresh fish. Fish is very good option in this situation because it's a low-fat, high-protein food, and to it very thin, very fine texture. The increased acidity of gastric juice should be reduced, and in the presence of inflammation with atrophy, as well as with periodic attack of vomiting, it's important to stimulate the functioning of the remaining functioning glands. So from one side to suppress high acidity, from the other side to ensure adequate stimulation of normal functioning of the stomach. Eating pattern. Take food at least 5 times throughout the day. At an aggravation of process of a diet adhere not less than 3 months. So at least 3 months are required in order to your patient to see the results. So don't discourage him if there is no, or yourself, if there is no results after 2 or 3 weeks. At least 3 months are required. Exclude from the diet are various damaging and toxic-forming products like mushrooms, radish, fatty meats, fried dishes, citrus fruits, grapes, soda, coffee, dark full grain bread. Usually we are recommended dark full grain bread for healthy nutrition, but in this situation they should be avoided. Onion and garlic and mustard. Exclude hot or cold foods, as well heavy and plain wool foods. Recommended the use of low-fat fresh milk. Raw fruits is better to replace with boiled or steamed. as well mashed potatoes or compotes. Welcome the use of porridge from rice, mango, oatmeal. All products are preferable ground, for example, in a blender. For these 3 months, this diet recommendation should be strictly followed by the patient in order to see some results. Menu diet with atrophic gastritis. Example: first breakfast, semolina porridge, boiled egg, rose hip tea, without sugar, without honey. Second breakfast at 10 o'clock, apple souffle, not raw fresh apple, but apple souffle. For lunch, soup from fresh cabbage, but puree blended, steamed chicken cutlet, tea with currant. Afternoon snack, cookies with tea, dinner cottage cheese with yogurt, and before going to bed, a cup of yogurt. And of course, the amount and the portion size are according to the nutrition patient. If the patient is overweight, small portions are recommended. For example, low-fat yogurt, but for everybody, low-fat yogurt is recommended. And if the patient is underweight or with low weight, below 18.5 index, body mass index, the portion should be increased. This is natural. And every week, the body weight should be monitored. What is not recommended with atrophic gastritis? Freshly baked bread, fresh pastries, buns, cakes, cream cake. The first dish made from peas, beans, cabbages, because meat products, smoked products, canned products, stew, canned, fatty meat, fatty fish, fish with bones, canned fish, salted and smoked fish, only fresh foods, fresh fish. Dairy products, products with high fat content, undiluted milk, margarine, vegetable, animal mixture, spreads and animal fat, raw vegetable, beans, ketchup, mayonnaise, sauce, and dressing, vinegar. Ketchup and mayonnaise, they have a high. Even ketchup has a high fat, so it should be avoided. Ice cream, chocolate, of course, products with cream and nuts, and soft drinks, grape juice, and alcohol. So a lot of food should be avoided. And of course, usually you have to give to the patient the list with all foods that should be avoided. And maybe if you use these 3 days records of food before coming to you, it's good to tick all foods that he avoided or all foods that he, by mistake, included in his daily menu. So in order to know what happens. Peptic ulcers. Peptic ulcer, usually the reason are gastritis, erosion through muscularis mucosa into submuscular or muscularis propagia. Aspirin and other non-steroids, anti-inflammatory drugs, Helicobacter pylori, and stress. So when you are asking the patient to explain what happens, how is his everyday life, you have to ask about stress, about Helicobacter pylori, or to send him for laboratory analysis, and what type of drugs he takes. Nutrition management, decrease consumption of alcohol, spices, particularly red and black peppers when inflamed, coffee and caffeine. So for some period of time, coffee and caffeine should be absolutely avoided. Increase intakes of omega-3 and omega-6 fatty acids, which may have protective effect. And good nutrition helps defend against Helicobacter pylori complication. But of course, treat Helicobacter pylori with drugs. Gastritis and peptic ulcer. In severe cases, resting stomach from food for 1 to 2 days may help alleviate pains. It means good hydration and only fluids and purees. Adequate fluids, including sugar and electrolyte, may prevent dehydration. Nutrient intake should be gradually increase over 1 to 3 days for providing other nourishing fluids, and then blend non-irritating foods. So step by step, every 3 days, you can increase the texture or the quality or the quantity of diet. Plant diet. Low-fat dairy milk. What include blend diet? That can be included after 3-day, for example, fluid diet. Low-fat dairy milk, yogurt, cottage cheese, if not lactose intolerance. Steam or boiled vegetable with no or little butter, very small amount. Carrots, peas, greens, beans, sweet potatoes, spinach, but steam or boiled and better blended. Processed grains, if not intolerance to gluten, plain soda crackers, soft white pasta. Cooked cereals, cold cereals that are low in sugar, especially low sugar, low concentrated carbohydrates like honey or jam should be avoided. Poultry, eggs and fish, skinless chicken, salmon, trout, eggs, silken tofu, cream soups, clear broths, chamomile tea, puddings, and basil and parsley as addition to improve the taste of the patient. What to avoid? High food diary, high flavored foods with high fat content, certain vegetables, cruciferous type, cauliflowers, Brussels sprout, broccoli, onion, garlic, peppers, cabbage, tomato and tomato products, seeded and acidic fruits, berries, grapes, prunes, orange, lemon, grapefruit. For some period of time, this fruit should be avoided. And also fruits and juice with perceivable acidity, other foods item, alcoholic, fatty dessert, olives, popcorn, granola, and nuts. And what is dumping syndrome? Maybe most of you are already aware. The dumping syndrome is a complex physiological response to the presence of larger than normal quantity of hypertonic foods and liquids in small intestine. What means hypertonic food? This is high sugary drinks or foods. It usually occurs as a result of surgical procedures that allow excessive amount of liquid or solid food to small intestine in concentrated form. For example, after a stomach resection, after a bariatric surgery, for example, sleeve resection of stomach, the syndrome occurs as a result of total or subtotal gastrectomy, manipulating of pylorus after fundoplication, and after some gastric bypass procedures for obesity. This is bariatric surgery, gastric bypass procedures. And fundoplastic usually is used for cancer, for ulcus, and manipulation of pylori also for cancer, also duodenal ulcus. Dumping syndrome. As a result of better medical management of peptic ulcer, use of selective vagotomies and newer surgical procedures to avoid complication, classic dumping is not as likely to be as severe as it once was. But after bariatric surgery is recommended during the first 3 months but not only during the first 3 months, but during the next 12 months after the surgery, to avoid high concentrated sugary drinks or foods. The severity of symptoms range from mild to relatively debilitating, depending on the nature of the surgery and the individual's dietary practice. Dietary intervention can reduce or eliminate symptoms in most persons. Early dumping. There are two types, early and late dumping symptoms. Patients may experience abdominal fullness and nausea within 10 to 10 minutes of eating of meals. Usually, this is after drinking soft drinks with sugar. This stage may be attributed to distension of the small bowel from food and liquid, plus some modest fluid shifts from system circulation into the small intestine as a result of ingestions of sugar or food that become hypertonic from the action of digestive enzymes. Patient may experience flushing, rapid heartbeat, faintness, and sweating, and feel the need to sit or lie down. It's very unpleasant. Intermediate stage, it can occur from 20 minutes to more than 1 hour after eating. Patients may experience abdominal bloating, increased flatulence, crampsy abdominal pain, and diarrhea. The colonic symptoms are related to the increased malabsorption of carbohydrates and other foodstuffs and the subsequent fermentation of the substances entering the colon, usually carbohydrates, simple sugars. And late stage, 1 to 3 hours after a meal, is related to reactive hypoglycemia. Patients feel anxious, hungry, shaky and hungry, have difficult concentrating, rapid change in blood glucose level, the secretion of gut peptides, glucose, insulinotropic polypeptide and glucagon-like polypeptide 1 appear to be partly responsible for the late symptoms when sugars go directly to the small intestine. Nutrition care guidelines for patients with dumping syndrome. Small meals regularly, small meals spread through the day are likely to result in improved net absorption and less dramatic fluid shift. Limiting refined carbohydrates. All foods that are source of refined carbohydrates and especially liquids. High protein, moderate fat foods is recommended, with sufficient calorie for weight maintenance or gain as needed. Complex carbohydrates are included as tolerated. High protein diet is usually recommended, or high protein meal. And includes small quantities of high fiber food if tolerated. Intakes of fibrous foods low upper gastrointestinal transit and increase viscosity. To avoid obstruction, caution should be used with large particle and fiber supplements, especially with esophageal or gastric narrowing or dysmotility. Laying down and avoiding activity an hour after eating may help slow gastric emptying. You know that if you are exercising just after eating, or this can increase energy utilization, and it can cause hypoglycemic reactions. So this is recommended also for people with diabetes. If they take insulin, this can increase the reaction, and the hypoglycemic effect should be profound. Drinking liquids separately from meals, taking large amount of liquids with meal is thought to hasten gastrointestinal transit, but adequate amount of liquid should be consumed through the day, small amount at a time. It means half an hour before and 30 to 60 minutes after a meal is allowed, but not more close to the meal. And this is the last slide. Only very small quantities of hypertonic concentrated sweets should be ingested, but for some period of time they should be avoided. This includes soft drinks, juice, pies, cakes, and frozen desserts, unless made with sugar substitutes. Lactose, especially in milk or ice cream, may be poorly tolerated because of rapid transit and thus may need to be avoided. Cheeses and yogurt are likely to be better tolerated. I mean, because your patient, they need calcium. So cheeses and yogurt, low-fat yogurt, are better, should be replaced the low-fat milk, fresh milk. The intensity of symptoms may resolve within 3 months of surgery. So between 3 and 6 months, the patient should keep this diet, and this is not diet, but this is a nutrition plan, and taking this recommendation more seriously. Well, this is for today. I promise you 60 minutes of your Saturday time. I'd like to wish a very happy Easter for my colleague who are celebrating this week, and enjoy your vacation for the next Saturday. Have a very good time. Maybe this is the best time of the year. At the end of April and the whole May. So be happy, healthy, and I'll meet you again at the end of April, yes, on the 30th. Okay. Thank you, Maria, Carolina, and Eleni, and Sotiris, if you are available. Very happy Easter to you. And to everybody, of course, but especially for you because your Easter is this week.